The gut and its microbiota may influence the heart. In this publication entitled Microbiome and Metabolome, Features of the Cardiometabolic Disease Spectrum by Fromentin et al., published in Nature Medicine on February 17th of 2022, basically addressed how previous studies of the microbiome have not looked into common conditions such as ischemic heart disease, IHD, until now. So they asked, are there any markers in the microbiome and the metabolome that are associated with IHD? And so they sampled 1,241 middle-aged Europeans that were either healthy, had metabolic disease, or were individuals at one of the 3 stages of IHD. And so what they basically took data from them. They took their phenome, they took their gut metagenome, they took some serum from them and their urine metabolome, and kind of tabulated all these results. Then they did an analysis and they saw that 75% of the microbiome and metabolome markers in IHD are different from healthy people, but similar to those with metabolic disease. And they did a test that was able to use the microbiome and metabolome markers to differentiate IHD from healthy and metabolome disease better than other techniques. So then they say that these results suggest that the microbiome and metabolome may have a role in causing or may cause IHD, but we must remember that correlation is not necessarily causation. Like just because that these markers are associated with people with IHD, doesn't necessarily mean it has anything to do with the disease. And so what I would ask is, how is this kind of addressing health disparities? Maybe they should have some different people from different ethnic groups, because just because this may work in one group of people may not necessarily work in others, since there's many different divergent characteristics in different subpopulations.
Hi, everyone. Today, I'm going to be giving the weekly report on COVID-19. The article that I read this week talked about the efficiency of using vitamin D as a way to reduce COVID-19 severity. Previous studies have shown that vitamin D has the ability to reduce inflammation due to the effect that it has on the T cells, which are the inflamed cells in the lung characteristic of the most severe and dangerous cases of COVID-19. This study was a meta-analysis of 7 systematic reviews, which showed strong evidence that vitamin D supplementation correlates to a reduced risk of mortality and has a significant impact in preventing and mitigating respiratory tract infections. Supplements that are both oral and IV are well tolerated, safe, and effective in COVID-19 patients.
Axioms of degenerate polygenic formulas are suspect for further investigation, as demonstrated by this preprint entitled Benchmarking Polygenic Risk Score Model Assumptions Towards More Accurate Risk Assessment. And essentially the background is that polygenic risk scores use different genetic markers in the individual, such as single nucleotide polymorphisms, phenotypic markers, and patient-reported information to predict how likely a person is to have a disease or phenotype. Polygenic risk scores can be calculated with many different formulas that use different assumptions. For example, the current age replaces the age at the analysis for the date of birth model, or the risk regression polygenic model employs death to compete with the disease. So these researchers asked, how do these 26 degenerate models compare to the traditional polygenic score formula? And they used Royston's pseudo R-squared for the degenerate models and deducted the R-squared from the traditional R-squared to discover that 15 out of the 26 lines fit to the data better than the original method's line for more than 50% of the diseases that they tested. And they also used reclassification rates. And with this method, with their particular reclassification rates, they discovered that the lines in 20 out of the 26 models exhibited significant changes to the predictions made using these lines compared to using the lines from the original model. So these researchers then argue that future research should mitigate making assumptions. And I ask, why is the traditional better than these degenerate models? Maybe there should have been more of a pairwise comparison.